Hello, everyone, and welcome to Humber College and the Pharmacy Technician Program. My name is Christine Herbert, and I'm a professor in the Pharm Tech program, and I'm delighted to be here with you to share a few little insights into our program and give you a little bit of a tour of what you can expect should you decide to register in this program. So I've got a few little quick slides that I'm going to share with you right now, so I'm just going to put those up on the screen. And there we go. So again, welcome to our virtual open house, and this is the Pharmacy Technician program at Humber College. I'll just take you through a couple of quick pieces of information just to give you an idea of what the program is all about. This is a 2-year diploma program that prepares you for careers in pharmacy. And now that can be in the community, so places like Shoppers Drug Mart or Rexall or Loblaws or Costco, any of those places that I'm sure you're familiar with, and perhaps you've even had a prescription filled at one of those places. But it also includes preparing you for places like hospital, where the patients are very much in need of qualified healthcare professionals to look after them. Or it could be in the industry, places like Glaxo or Pfizer, who are big manufacturers, and they often employ pharmacy technicians as well. And very much the long-term care sector is looking for qualified healthcare professionals to look after the medication needs of the residents in the homes across the province. So this is actually a very exciting and interesting area for pharmacy technicians. The courses that you would take are designed to build your knowledge, skills, and abilities in a number of key areas. We usually start you off by teaching what the legal responsibilities are of a pharmacy technician, and we talk a lot about the ethical responsibilities and the things that you need to do to make sure that your patients are always cared for and that we always prevent harm from happening to any of our patients. One of the key aspects of your development in the program will be learning how to distribute the products. So that's dispensing medication, packaging medication, for example, into blister packs, ensuring the quality of the product, ensuring that it's filled correctly and accurately, and releasing that product to the patient. We also spend a fair bit of time on health promotion and educating patients on how to use their devices. So for example, a blood pressure monitor, or perhaps an asthma inhaler device of some sort. And we teach you how to manage all these things and working with other health professionals as well. So you'll find yourself working with doctors and nurses and other healthcare providers, of course pharmacists. You'll be working quite closely with them. All of this actually focuses very much on the safety of the patient, and to that extent we do have a tremendous focus on preventing errors. So accuracy and proficiency in the dispensing process is really one of the things that we do focus on in building your skills in this program. All of this takes place in a slated lab, and we have some wonderful spaces for you to experience what it's like to work in this environment, and we simulate actual practice, and that you actually fill prescriptions on dispensing software and counting the medication and putting them in the appropriate packaging, and learning all about that process as well. Now, you might be curious about what the 4 semesters and the 2 years might look like, and I've put a little slide up here for you to take a look at that talks about the different courses that you would be taking. Again, we start you off with some very basic theory and education about dispensing, and we gradually build on those skills. One of the courses that I'd like to highlight for you is actually in 3rd semester, which is the aseptic compounding, and that's the course where we teach you how to do IV preparations for patients who are in hospital and long-term care. That's a very specialty oriented area of practice, and one that, quite frankly, a lot of our students find to be quite enjoyable and very practical in terms of their skills. In fourth semester, there is a work placement, and that means you get to go out and practice all your skills in the work environment. And we have some wonderful places to send you for that. This slide just shows you a little picture of the aseptic compounding lab that we have, and you can see that it is very much up to date and very practical and simulates that practice as well. One of the things that we pride ourselves on is that low student to teacher ratio. So you will get a lot of hands-on help from your professors as we teach you these skills that are necessary for your profession. And as I mentioned previously, the placement in fourth semester is probably one of the most exciting parts of the program. You will spend 360 hours out in both hospital and community placement. We have a wonderful Office of Experiential Learning who will assist you in placing you at an appropriate placement site. So one of the benefits of this program is that you do not have to go out and look for placement sites. We will assist you in finding those sites. This is a wonderful opportunity to apply all your learning in an actual workplace, and many of our students report back to us that they have been hired by their placement sites and have found jobs as a result of this experience. The last thing I would like to mention before I wrap up is that this is a fully accredited program. We take great pride in having that accreditation, which means that once you graduate with your diploma, you can go on to attain your licensing as a health professional, as a pharmacy technician, which is a recognized health profession in the province of Ontario. So that's a wonderful pathway forward for you to become a health professional. Thank you for taking the time to listen to this very brief presentation, and I will be happy to answer questions at the end in our Q&A sessions in the virtual open house. So once again, thank you for listening, and we'll talk to you soon. Take care.